And welcome back into Crosstalk. On this morning's edition of the program, we're going to talk with Davita. They're the company that took over the dialysis center here in Sterling, Colorado, and we're joined on this morning's edition of the program by a dietitian from the East Aurora Dialysis Center, Megan Buckendahl. Thank you so much, Megan, for being a part of the program today.
Great, thank you for having me.
Your story is quite the story. I mean, you're not only somebody that works in a dialysis center. You've actually been on and off dialysis and had 2 kidney transplants. Tell me a little bit about your story.
Well, my first time on dialysis was in 1993 to 94. I was 18 years old and was diagnosed with end-stage renal disease, which is the last stage of kidney disease. And so I was on dialysis for about 10, 11 months, and then I was blessed enough to receive a kidney from a cadaveric kidney, so somebody that had passed away. And I had that kidney for 13 wonderful, wonderful years, and was back on dialysis here in the Denver area with Davita, in fact. And I was on dialysis again another 10, 11 months. And I was once again blessed to receive a kidney from my mother, and that has been just over 4 years now. So,
you know, obviously it's a very difficult thing you've been through, but keeping your spirits up, obviously, a very big part of what you've done. There's some common thoughts here. We had a former employee here at the station deal with kidney failure as well. She's actually currently still dealing with it, and some of the questions that I know come are kidney disease. What are the signs? That's in the medical field. We're always looking for signs. So let's start with that. How does somebody know if they have chronic kidney disease like what you had?
Well, there's definitely some signs and symptoms towards the end stages. In the beginning stages, it's hard because there's not a lot of signs and symptoms. But towards the end, you can have fatigue and maybe swelling in your lower extremities, shortness of breath, maybe some nausea, vomiting, itchy skin, muscle cramps. Those are the main ones. Definitely talking to your doctor. The two main reasons that your kidneys can fail is from high blood pressure and diabetes. So if you have either one of those, or a family history, or people that are a person of color are definitely a higher risk for those diseases. So those are some of the things that we look for.
How do you test for kidney disease?
It's a simple blood test, and your primary care doctor can do that for you.
Does it happen as a part of your normal physical, or is it something you have to ask for?
Usually it's part of a normal physical. It's just on the complete metabolic panel, so it's right there. It's called creatinine. Okay,
so you look at that now. Obviously, you can watch for all of these signs. A lot of people have a phobia of doctors, have a phobia of dealing with this. What happens if you leave chronic kidney disease untreated?
Well, you definitely, if you get to the later stages of kidney disease, your kidneys will completely fail, where they're not filtering any of the toxins out of your system or the excess fluid. And at some point, if you don't go on to dialysis, it is death. You will die.
We hear dialysis, and I think a lot of people, you see what you see in the movies, and that may not necessarily be reality. So what's dialysis, and what's life on dialysis like, since you've been through it twice now?
Dialysis is a treatment. So what it does, it replaces the kidney function, such as filtering the blood and the extra fluids like your kidneys would normally do. And you do it 3 times a week for roughly 4 hours at a time. So, you have to get there early and come to dialysis 4 times a week and sit in a chair connected to a machine for 4 hours. And afterwards, you're usually pretty wiped out and exhausted. And you go home and you sleep and maybe get up and eat and go back to bed. And usually on your days off, you have doctor's appointments to follow through and follow up with, especially if you're moving forward with transplant and being worked up for that. So it's definitely a lot.
It is a lot. Now, can you describe to me what exactly, from a medical standpoint, dialysis does for your body? I mean, it replaces your kidney functions. How does it do that?
It filters the blood and removes the extra toxins in your blood that your kidneys would normally do, and also removes excess fluid that your kidneys would normally produce, urine, and to get rid of those toxins. And so the dialysis will get rid of the excess fluid and the excess toxins in your blood.
Now, you do have to go in, but I know there's multiple types of treatment on dialysis. What are some of those?
We have the very typical in-center hemodialysis, where they come in 3 times a week for dialysis in a center, and then we have that's usually during the day, and then we also have a nocturnal program, which means at night. So they come 3 nights a week and dialyze for 6 to 8 hours, those 3 nights a week. Then we have peritoneal dialysis, which you can do at home, and it's needle-less, and it involves your abdominal cavity. And we also have where you can do home hemodialysis at home.
Obviously, these are all very important factors as we're talking with Megan Buckendahl. She's with Davita, who recently took over the dialysis center here in Sterling. And I guess we need to step back a little bit, maybe here for some numbers. How many people have kidney disease in the U.S. and maybe even here in the state of Colorado?
Well, there's 31 million people in the United States that have kidney disease, and that means 1 in 6 adults. So, and most of them don't even know that they have it, because those early signs are usually you don't have any symptoms. So.
You don't have those symptoms, but there are some risk factors. I know you mentioned them a little bit earlier, but can you delve into a little bit more in depth on the risk factors?
Sure, yes, definitely. If you have high blood pressure, if you are diabetic, if African Americans have a four times higher chance of getting chronic kidney disease, and Native Americans and Hispanics and Asian Americans also have a higher chance because they're at higher risk for hypertension and diabetes. If you have a family history, definitely you are at risk for having chronic kidney disease as well.
Diet is something obviously ahead of time that can control some of the kidney disease. What are some things that if you don't have kidney disease you should avoid eating or you should limit your intake on with your diet?
Definitely, the eat right is definitely appropriate for preventing you from going on dialysis, which also prevents, diabetes and high blood pressure. But specifically, just eating healthy as far as low salt, low saturated fat, and just watching your portion control and losing your excess weight is a big deal for preventing diabetes and high blood pressure as well.
Once you go, however, into dialysis or kidney failure, your diet has to change as well, and you've been through it. What is that diet change once you're into a position where you're starting to be the kidney failure or even you're on dialysis? How does diet change?
Once you're on dialysis, unfortunately, the diet is very restricted. The kidney definitely filters your blood, and so when you don't have the function of that 24/7, you need to have a very low potassium diet, low phosphorus diet, low sodium diet, and you usually have a fluid restriction. So there's a lot of restrictions that come into play with what we call the renal diet once you're on dialysis.
Quite a few restrictions, but obviously you guys at Davita have helped people go through that as well, correct?
Absolutely. We walk you through that. We can help you with whatever that looks like for you. If you're diabetic on top of having the renal diet, we can walk you through menu plans and recipes. It's very supportive here.
How does, for you, having been through this really for the last almost 20 years now, help you with your job?
Undescribable, because I can be able to walk them through what they might be feeling, because it's very overwhelming, and a lot of our patients definitely have depression along with this. It's a typical thing with just chronic illness in general. And so being able to walk them through what they might be feeling or what might be the next step of the unknown that's out there. If they're going through the transplant process, there's definitely testing that is involved with that, and making sure that they know what that looks like so they're not scared going into that. Definitely, I've been through almost all the different testing that's out there. So it's really nice to be able to say, this is what to expect, and try to hold their hand through that so they're not as scared.
You've been through just about all of it, and you led me right into the other thing I wanted to talk about, because organ donation is very important. You've actually experienced both sides of organ donation, from someone who has passed away and somebody who is alive. What do people need to know about organ donation? Because I know, like doctors, it's something that a lot of people are very scared of and maybe shouldn't be.
Yeah, I think that one of the most important things is being educated, if that's the right, option for you, if you want to donate to somebody you love or a stranger or however that looks for you. And there's a lot of information on like organdonor.gov to be able to look and see if that's the right option. But to be able to donate for a live donor, they work you up almost the same as they would the recipient, and they do testing such as making sure your heart is okay, making sure that you will do okay under anesthesia, and just making sure that you're overall healthy to be able to donate to a loved one or even a stranger. We've had that before too. So
it's obviously something you don't need to be scared about because the people that are doing this are very experienced in doing it. This is not the horror movies where you wake up in a bath of ice.
Not at all. I mean, we send, whether you're a recipient wanting to receive or if you're wanting to donate, you go right to the transplant center, and they are the experts regarding transplant on both ends, and they can walk you through all the different steps and procedures to move forward with it.
Obviously, this is something very important, and plenty of information out there on donation, on kidney disease, and really, a lot of educated people that work for Davita. Megan, one of those, having been through this for almost 20 years now. Megan, thank you so much for being a part of Crosstalk today.
Great. Thank you for having me.